Hi, I'm Dr. Stephan Smith of Advantage Family Chiropractic. What I'd like to talk a little bit about today is back surgeries, pros, cons, what have you. Now, I'm a chiropractor, so right off the bat, you're going to assume, and rightly so, that I'm going to be more or less against back surgeries. The reason for that is going to be because back surgeries are often rushed into, I guess is a good way to put it. I've seen patients for many, many years, and I see what these people come in with from a degenerative standpoint, and I know that a lot of times the reason for this degeneration has to do with lack of normal motion, subluxation, which is a chiropractic word meaning bone out of place, putting pressure on nerve. That can affect the nerve roots that exit from the spinal column. It can affect the disc and the disc health and what's going on with that disc, and then how that disc affects the nerve as it comes out from between the vertebra. All of these things have to do with motion and position and freedom of movement and degenerative changes. A lot of these things can be modified conservatively, meaning with exercise, with some physical therapy even, with some core strengthening, with chiropractic care. Things that can be done before you go under the knife. My brother is a first assistant, a surgical assistant, and he's worked with several orthopedic surgeons and neurosurgeons, and this is a guy who basically sees that medical model of handling low back problems all the time. And he told me point blank, these back surgeries are only 50-50 as far as their effectiveness goes. That means that only half of them are successful. Half. If that's the case, if only half of them help people, and I've seen where they've actually made people worse, why wouldn't you try something conservative first? So many people come into my office after having tried a couple of other things and then gone and had surgery that didn't work, and then they're in my office saying, "Oh, you got to help me." And chiropractic still winds up helping them. So why wouldn't you try something conservative first? It isn't scary. Get informed, go talk to a chiropractor. Most chiropractors will give you a free consultation so that you can see what they're planning to do, how it works, how it can help you, how it could help you prevent the need to go and get a surgery that may or may not be effective. The other thing to consider when you're talking about surgery is that if you're talking about a surgical fusion, meaning they go and actually put bone in there, or graft bone in there to keep two bones from ever moving again, now you've got two vertebrae in the spine that never move anymore, and so the vertebra above it and the vertebra below it have to kind of pick up the slack for your normal movement, which puts additional strain on those vertebrae, and then they eventually degenerate and have problems. You don't want to have surgery if you don't have to have surgery. Call a local chiropractor, call me, my number's on the website, I'll be happy to talk to you about it. Consider other options before you jump into surgery. I'm Dr. Stephan Smith with Advantage Family Chiropractic, and ask questions first.